Imagine this. You're at home alone. Maybe watching TV. Maybe just winding down from a long day. Then, out of nowhere, a sharp pain shoots through your chest. Your arm feels numb. You're sweating. Breathing becomes harder with each second. You're having a heart attack. And there's no one around to help. In that terrifying moment, what you do next can mean the difference between life and death. Most people freeze. Some panic. Others simply don't know what steps to take. But if you're alone and time is ticking, knowing exactly what to do could save your life. This isn't about being dramatic. It's about being prepared. Heart attacks don't just strike the elderly. They can happen to anyone, at work, on the road, even in your sleep. And the scariest part? Many heart attack victims never make it to the hospital simply because they didn't know how to respond in those first critical minutes. But you don't have to be one of them. How to recognize the symptoms of a heart attack. Recognizing a heart attack early can save your life. The most common symptom is chest pain or pressure, often described as a squeezing or tightness that lasts more than a few minutes. You may also feel pain in your left arm, neck, jaw, back, or stomach. Other warning signs include shortness of breath, even without chest pain, cold sweats, nausea, or a feeling of lightheadedness or dizziness. Some people report a sudden sense of impending doom or extreme fatigue. Women may experience more subtle signs like unusual fatigue, indigestion, or pain between the shoulder blades. If you feel any of these symptoms, especially more than one at a time, don't wait. Treat it as a medical emergency and act fast. In this video, we're revealing 7 life-saving tips that could help you survive a heart attack alone. These are real strategies based on medical advice, not myths. Some are so simple, you'll wonder why no one talks about them more often. So stay with me. Take a few minutes now to learn what could save your life, or the life of someone you love. Because when a heart attack strikes, every second counts. 1. Call emergency services immediately. The very first and most important step when you suspect a heart attack is to call emergency services immediately. In the United States, that means dialing 911 without delay. This may seem obvious, but in moments of panic, many people hesitate. Some convince themselves it's not serious. Others think they can drive themselves to the hospital. But here's the truth. Every second matters when a heart attack strikes. When you call emergency services, you're not just getting a ride to the hospital. You're getting trained medical professionals who can begin life-saving treatment the moment they reach you. Paramedics can administer oxygen, medications, monitor your heart rhythm, and prepare the emergency room before you even arrive. This early intervention can significantly increase your chances of survival and reduce long-term damage to your heart. Driving yourself is dangerous. If your condition worsens behind the wheel, you could harm yourself and others. Don't take that risk. Instead, call for help, unlock your door if possible, and sit or lie down somewhere safe while you wait. Even if you're not 100% sure it's a heart attack, it's always better to be safe than sorry. Heart attacks can be silent or have mild symptoms, but that doesn't make them any less deadly. So remember, the moment you feel warning signs, chest pain, shortness of breath, nausea, or dizziness, call emergency services right away. That call might be the most important one you ever make. 2. Chew and swallow an aspirin, if available. Once you've called emergency services, the next step, if you're not allergic and have aspirin nearby, is to chew and swallow 1 standard adult aspirin, 325 milligrams, or 4 baby aspirins, 81 milligrams each. This simple act can play a powerful role in saving your life during a heart attack. Why aspirin? It works as a blood thinner, helping to prevent the clot that's blocking blood flow to your heart from getting larger. In many heart attacks, a clot forms over a ruptured plaque in a coronary artery. This blockage stops oxygen-rich blood from reaching the heart muscle, causing tissue to die. Aspirin slows the blood's clotting ability and helps keep that artery at least partially open, buying critical time until medical help arrives. Now, here's the key part. Chew the aspirin instead of swallowing it whole. Chewing breaks the pill down faster, allowing it to enter your bloodstream more quickly. Time is everything when your heart is at risk. Studies have shown that chewed aspirin begins working in about 5 minutes, while swallowed aspirin takes 10 to 12 minutes or more. Make sure you're taking plain aspirin, not enteric-coated or time-release versions, as those are slower to absorb. Also, don't take aspirin if you're allergic to it or have been told by your doctor not to take it due to medical reasons. So, if you're experiencing symptoms of a heart attack and have aspirin within reach, chew it immediately after calling for help. It's a small pill, but it can make a life-saving difference when every minute counts. 3. Stay calm and sit down or lie down. In the midst of a heart attack, one of the most important things you can do to help yourself is to stay calm. It might sound easier said than done, but panic can worsen the situation. When we panic, our body goes into fight or flight mode, causing a surge of adrenaline that increases your heart rate and blood pressure. This puts even more strain on your heart during an already stressful time. Staying calm helps to keep your heart rate stable and allows you to think clearly. If you're feeling the symptoms of a heart attack, chest pain, shortness of breath, dizziness, or nausea, it's crucial to sit down or lie down in a comfortable, relaxed position. Avoid moving around unnecessarily or attempting to walk. Exerting physical activity could worsen the strain on your heart. Instead, focus on staying still and breathing slowly. Sitting upright in a chair or lying on your back in bed with your head elevated can help relieve some of the discomfort. Positioning your body carefully can also help alleviate some of the pressure on your chest, allowing for better airflow and reducing the feeling of suffocation. If you are feeling lightheaded or dizzy, lying down with your feet elevated slightly might improve circulation and prevent fainting. It's also important to try to stay as still as possible. Avoid any sudden movements, as they could trigger more discomfort or cause more stress on your heart. By keeping calm and in a stable position, you'll be helping your body function in the best way possible while waiting for medical help to arrive. In an emergency like this, being calm and still is a life-saving strategy that can give you the best chances of survival. Stay focused, breathe slowly, and remember, help is on the way. 4. Loosen tight clothing to breathe easier. When you're experiencing a heart attack, your body is under significant stress, and your breathing can become labored or shallow. One often overlooked step to ease this difficulty is to loosen any tight or restrictive clothing. This simple action can help reduce pressure on your chest and allow for easier breathing. Clothing that is too tight, especially around the chest, neck, or abdomen, can add to the discomfort and make it harder for your lungs to expand fully. During a heart attack, your heart is already struggling to pump blood efficiently, and any external pressure can make breathing even more difficult. Tight clothing can also lead to a feeling of tightness in your chest, which only exacerbates the panic you might already be feeling. To help yourself breathe easier and avoid further anxiety, immediately loosen any tight clothing. If you're wearing a buttoned shirt, open the buttons. If you're wearing a belt, loosen it, or if you can, remove it altogether. Take off any tight jewelry like rings or necklaces that might be restricting circulation or adding to the feeling of discomfort. If possible, consider changing into more comfortable, loose-fitting clothing. This can help you feel more at ease and prevent additional physical strain. A relaxed, comfortable body can support better circulation and may even help lower anxiety, which is crucial when you're trying to stay calm. Taking these small steps to remove physical restrictions can help you focus on your breathing and keep your mind clear as you wait for emergency services to arrive. Every little action you take to ease the strain on your body during a heart attack counts, and this is a simple yet effective strategy to help you breathe easier and stay calm. 5. Cough repeatedly if you're fainting. If you're alone and experiencing the symptoms of a heart attack, you may also begin to feel lightheaded or faint as your body struggles to pump oxygenated blood to the brain. In those moments when you're at risk of losing consciousness, it's important to take action immediately to try and keep yourself alert and stable. One potential life-saving technique in this scenario is coughing repeatedly. This method is sometimes referred to as cough CPR, though it's important to understand that it's a temporary measure and should only be used when you're in danger of fainting or losing consciousness while waiting for emergency help. The action of coughing repeatedly can help keep your heart beating by increasing pressure in your chest, which might help maintain blood flow to your brain and keep you conscious long enough for help to arrive. Here's how it works. Take a deep breath and then cough forcefully, as if you're trying to clear something from your throat. Do this repeatedly, every 1-2 seconds, until help arrives. This deep, forceful coughing works by temporarily increasing the pressure inside your chest, stimulating the heart to keep pumping blood. The repeated coughing can also help with circulation by forcing blood back to the heart, reducing the risk of fainting. While this technique can be helpful in emergency situations, it's crucial to understand that it's not a substitute for proper medical intervention. It's only meant to keep you stable until paramedics arrive. Don't rely on this method alone. Always call emergency services first to ensure professional help is on the way. If you're able to keep yourself conscious by coughing, you'll have a better chance of surviving the initial moments of the heart attack while waiting for the medical help you desperately need. 6. Avoid driving yourself, wait for help. If you're experiencing a heart attack, one of the worst things you can do is try to drive yourself to the hospital. While it may seem like a good idea in a panic, especially if you feel you can't wait for help, driving yourself is incredibly dangerous and could make the situation worse. Here's why. When you're having a heart attack, your body is in a critical state. Your heart is struggling, and your blood flow is compromised, which can lead to dizziness, shortness of breath, and even a sudden loss of consciousness. The risks of fainting, losing control of your car, or causing an accident while driving are too great. Instead of trying to drive, call emergency services immediately. Paramedics are trained to provide life-saving treatment during transport to the hospital. They can administer oxygen, monitor your heart's rhythm, and give you medication that may reduce the damage to your heart. Ambulances are equipped with tools and personnel who can intervene in the event of a cardiac arrest or any other complications while en route, which could save your life before you even reach the hospital. Additionally, driving yourself can delay critical medical treatment. The time it takes for emergency responders to reach you can significantly impact your chances of recovery. Every minute counts during a heart attack. The longer you wait, the more damage can occur to your heart muscle, reducing the likelihood of full recovery. If you feel yourself getting worse or find it too difficult to focus on driving, pull over immediately and call for help. You need to stay as calm as possible and wait for emergency services, even if it feels frustrating. Your life is worth far more than the time it takes for an ambulance to get to you. 7. Keep your phone nearby and door unlocked for paramedics. When you're experiencing a heart attack alone, every second counts, and small actions can make a huge difference in your survival. After calling emergency services, one of the smartest things you can do is to keep your phone within reach and unlock your door so paramedics can enter quickly when they arrive. Keeping your phone close ensures that if your condition worsens, you can still communicate with emergency responders. If you suddenly feel faint or lose mobility, you'll want to have your phone right by your side in case they need to locate you, talk you through breathing exercises, or keep you conscious until help gets there. Don't leave your phone across the room or in another part of the house. Set it beside you and put it on speaker mode if possible, so you can hear instructions without needing to hold it. Unlocking your front door or any main entrance is also critical. Paramedics need fast access, and every moment spent trying to break down a locked door is time that could be used saving your life. If you live in an apartment, consider notifying a neighbor or security guard after calling 911. Just a simple unlocked door or someone guiding emergency workers can shave off precious seconds. If you're too weak to get to the door, let the dispatcher know. Many emergency services can pass that info directly to the medics en route. These simple steps, keeping your phone nearby and unlocking your door, can make a life-saving difference. They help ensure paramedics can reach you faster and provide the urgent care you need without delay. When you're in a life-threatening situation like a heart attack, being prepared in these small but important ways can give you the best chance at survival. A heart attack can strike without warning, and if you're alone when it happens, those first few minutes are absolutely critical. But knowing what to do can make all the difference between life and death. From recognizing the early warning signs to calling emergency services immediately, every step you take matters. Chewing aspirin, staying calm, and positioning your body safely are all actions that can support your heart and brain while help is on the way. Loosening tight clothing, avoiding driving, and unlocking your door may seem like small steps, but in an emergency, they can shave off valuable seconds and potentially save your life. Keeping your phone close and staying alert as long as possible ensures that you stay connected with emergency services throughout the crisis. No one ever wants to be in this situation, but being prepared just in case can protect your future. Share this information with loved ones and review it often. When a heart attack hits, there's no time to Google. There's only time to act. Be ready. Stay calm. And most importantly, never ignore the warning signs. Your quick actions could mean the difference between surviving and not.